Hello, guys. Good evening. So, in my previous video, I spoke about coming back to the Gambia from Sierra Leone, and I have the privilege and honor to stay with one of my favorite uncles of all time in the Gambia, and he happens to be an eminent surgeon, doctor, philosopher, life coach. Whenever I'm in this man's presence, I always feel like it's a true blessing to be able to glean all the pearls of wisdom that he just sprinkles my way. And I felt it was rather fitting to share some of the things that he may have to say, his views on life in general, the medical world, etc., with you guys. As you know, I have been sharing my journey with you regarding my story with endometriosis, and always trying to impart to you words of wisdom and instill some inspiration into you, so you know that there's definitely light at the end of the tunnel. But without further ado, let me introduce you to, everyone fondly refers to him as Doctor, but to me he is Uncle Ulrich. And here he is, Uncle Ulrich.
Yes.
So I have you here on my YouTube channel, which I rather aptly named Simi's Eskie Platform. Mm-hmm. And Eskie is an acronym for empowering, sharing, connecting, informing, engaging. Mm-hmm. And that came out of my frustration from a lack of communication, people not really wanting to openly discuss conditions that they may be suffering from. And this was something that I experienced myself at the height of my troubles with endometriosis, and me eventually ending up in hospital and having multiple surgery. There's a huge lack of knowledge in the medical profession, certainly in the UK. And that was just exacerbated, I felt, by this lack of communication, even among sufferers. So I couldn't even find other women who suffer from the illness to bounce ideas off, to talk to, or to just feel like, you know, you have a kindred spirit that you can relate to. So that's more or less a kind of brief background as to why I started vlogging and doing videos on my YouTube channel. So, Uncle Ulrich.
Yes.
Where do I start?
You want me, first of all, to give you my own views and lifetime experience with the condition called endometriosis.
Yes. But first of all, actually, I'm just thinking maybe for the viewers, I mean, I am familiar with you and some of the things you've done. Maybe just give a brief intro about Dr. Mr. Ulric Jones. And
well, I've had a long medical career. I'm very fortunate to be somebody who likes to become a doctor because I admired my uncle. And I'm also very fortunate to be brought up by a father who behaved like a regimental sergeant major. So discipline was imparted into me since I was a very small child. And of course, discipline is what takes you over the line when you have knowledge and wisdom and so many other things that can make you good. But if you're not disciplined, of course, you have a problem. I managed eventually to get into medicine, having first looked like a priest, and then having a flirtation with going into the Sierra Leone army. And eventually, I settled for what I wanted to do when I was 7 years of age, and that was to do medicine. I've been very fortunate also in many respects that in spite of so many hurdles, I qualified as a doctor when I was 23, and then went on to qualify as a surgeon when I was 28, which were existing records. I hope they've been broken, because progress only comes when people do better than the previous generation. So I will actually encourage people to give in their best and break all the records that I ever made so that we can say Africa is going forward.
indeed.
Now, coming back now to my career, just briefly, I've worked in quite a few places and countries, but particularly most of my career has been in Africa, and most of my experience is based on using my head beyond what I learned in textbooks. In other words, having a good sense called common sense, and also being humble and being willing to learn from people who are stratified below you in the hierarchy of authority. So I'm willing to learn from my orderlies, from my nurses, from anybody for that matter. In other words, I've always been hungry for true knowledge. So my career has now spanned for something. If I look at the time, I started medicine in 1959, and so last year was 60 years since I was exposed to it. I qualified as a doctor in 1964. That means medical practice had gone on for 55 years. And as far as the field of surgery is concerned, I qualified in Edinburgh in 1969. And last year was, in fact, my 50th year as a practicing surgeon and a general surgeon and a neurosurgeon. And in fact, I was thinking of quitting, only to find with great horror that my joints were still moving well, my hands were steady, my eyes were still good, and the Almighty had decided I should go on to serve humanity.
Thank God for that.
But not to avoid the truth that I have slowed down, which sometimes irritates me, but still, there's a process called aging. You fight with Mr. Age. You fight and fight and fight. Eventually, Mr. Age wins. I hope the fight goes on for a longer time before he wins. The best part of my career has been spent in the Gambia. Remarkably, the man who I admired to the point where I decided to be a doctor was born in the Gambia in 1893. That's the very famous Dr. Radcliffe Dugan Jones, whose statue you will see in the Taylor Cummins Garden near the CID office in Freetown. And the statue shows you a doctor holding a stethoscope. And to me, he earned it to be put there. It was a great example of what the medical profession now should be. He was kind. He worked very hard. He sacrificed a lot. And he died early at the tender age of 57. I have made 79 last year, and I feel guilty about it that I haven't worked myself to death as he did. But still, these factors are determined not by you, but by circumstances and the Almighty. He was born in the Gambia, and he was buried in Freetown. I've been born in Freetown. I have a suspicion I may end up my days in the Gambia. But forgetting that comparison, it just shows you that medicine has nothing to do so much with where you were born, but what you can do for humanity. It has nothing to do with your racial background, your religious background, but you must follow the medical code, which is based on religious principles that are recognized by all the religions. And I'm very happy to say that I have felt free to treat all people, even those who don't practice a religion, because I look at them as somebody created through a mother by the Almighty Creator. My practice has involved general practice, public health, surgery, obstetrics, gynecology. You call it, I've been involved in it because I've always been willing to help. And because I was somebody I've always been somebody who was willing to learn outside my field, I've been able to do work on the eyes, the sinuses, virtually every branch of surgery I have practiced. Now, I can talk about something of the things that are rare and obscure cases, like the one I'm being challenged by this young lady. It's a very rare condition, in a way, called endometriosis, and it affects the female sex. Endometriosis is a disorder involving endometrium. The endometrium is the layer that lines the internal surfaces of the womb and the fallopian tubes. It's supposed to be confined to that section of the genital tract. But for some strange reason, by some mishap or variation of embryological development, this lining layer, which should only be confined to the uterus, is found outside the uterus. It can be found covering the ovaries. It can be found covering the outer lining of the bowel. It can be found around the navel. It can be found in certain ligaments and in the pelvis. And to make it really weird, endometrial tissue has been found even in the respiratory tract, in the nostrils, and even in the lungs.
And the brain sometimes.
And even can be present in the brain. Now, the problem with endometriosis is that these extra uterine accumulations of endometrial tissue will respond to the hormonal fluxes that bring about the menstrual periods. In other words, every time a lady who has endometriosis goes through an ovarian cycle, the menstrual phase is witnessed by bleeding in all these tissues. Now, remarkably, when a woman gets pregnant, the hormonal fluxes will normally result in the ablation of endometrial tissues. But if the periods just come and go, the end product is sometimes the production of a cyst which contains blood. And after some times, when blood starts to change, the color changes from red to chocolate. So in fact, they've been called chocolate cysts. Now, what was found scientifically is that if you want to treat endometriosis, you have to first recognize it. And you can only recognize endometriosis if you're well read and you work with a high index of suspicion. In other words, if you were treating a young person, a young female, and they're having menstrual disorders and too much pain and torment, and they have pain all over the place when they're having the periods, your mind should cross into endometriosis. Nowadays, there are so many weapons for diagnosis, and it shouldn't be as difficult as we had in our, as like in the early part of my career. You wouldn't have the paraphernalia to make the diagnosis easy. Now we have, but with early recognition, you have the prospect of a good outcome in treatment.
Can I just interject there? So in my case, Uncle, as I was saying, I was diagnosed through a procedure called a laparoscopy. They used a laparoscope, inserted a few holes, if you like, into my abdomen, and that was how they were able to determine that it had spread all over and gone to my bowels, etc. So they just had to close me up. I had to then wait a few weeks and have full-blown surgery, which was a laparotomy. So, two questions. One, what are the better, more contemporary methods that they could use these days to confirm whether a woman does indeed have endometriosis?
Well, again, I say it comes from an high index of suspicion based on the symptoms they're presenting. Most women who have pain with the periods, we call it dysmenorrhea, don't have endometriosis. They have an abnormality of the contractility of the uterus and the ability of the neck of the womb to relax so that the blood will come out during the periods. Okay? Now, the endometrial tissues, as I say, seem to be influenced by the hormonal changes during pregnancy. Because it has been shown in many cases in the past that somebody with endometriosis, if they do get pregnant, that's the end of the endometriosis. So what was being used initially was to use drugs that create what you call a pseudo-pregnancy. Most of them, in fact, are contraceptive agents. But the proportions of various hormones are designed to create a situation where a pseudo-pregnancy occurs. That should always be, in my humble view, the first line of treatment.
Being put on the pill?
Now, should be the first line of treatment, as far as I'm concerned.
Okay.
And if it fails, that is when complications develop, like the formation of large cysts in the pelvis, in the uterine ligaments, in the ovaries. Those call for surgery, yes. And as I say, the earlier it's detected, the better. Because even when you give pseudo-pregnancy treatment, you will really reduce the disabling nature of the disease. And I believe that people should be given at least a 6-month course of these drugs at the very beginning.
So after that 6-month period, what's the best method of detection in your case, in your opinion? Is there an ideal surgical procedure?
No, the laparoscopy was the ideal thing to look in and see. But what followed the laparoscopy will depend on what is said, what they find. And usually, if you have to be opened up, if the patient has to be opened up, it means it's extensive.
Is there any alternative to being opened up, to having full-blown surgery like a laparotomy? Because in my case,
a lot of operations have been done through the laparoscope by people who have spent a lot of time learning how to use the instrument and its appliances that are attached to it. In the United States, for example, over 80% of surgeries are now being done, particularly gynecological procedures, including removing the uterus, can be done through a laparoscope.
That's because of the advances in medical technology.
Yes, but it's somebody who has the individual skills to do it, and the training to use a laparoscope as the operating laparoscope takes time.
I think I was just very unfortunate in that they couldn't use a laparoscope for the surgery. I had to be opened up.
Well, even
and have
laparoscopes
full-blown
have
surgery.
changed in their design and things. So this is just purely fortuitous. But that would be the choice, a laparoscopic surgery.
Just to minimize
Yes.
the danger of anything going wrong. Yeah, and I can testify to that. So once a woman has had surgery and has recuperated, in my case, it was after I'd gone through the recuperation period that my surgeon sat me down and explained and said to me that there is no cure for endometriosis, because I was quite surprised after all the complications and all the operations that when I did have my periods again, the pain came back with a vengeance.
Which means endometrial tissues were still left behind.
Now, I didn't know this at the time.
Because, you see, the endometrial tissue will bleed. The bleeding will irritate the peritoneum and you will feel pain. It's as simple as that.
It was a revelation. And I guess for women out there who, feel that they have no choice but to go through surgery, and then obviously after that it's a question of managing. Is there any key advice you'll give to women to be able to manage the condition going forward? So you've had surgery, say, the doctors have done, the surgeons have done as much as they can, but you now have to, you're left on your own.
I'll put it to you this way.
To manage it.
With hindsight, even if I do a laparoscopy, I make a diagnosis and it's extensive, I'd rather do a protracted treatment with pseudo-pregnancy drugs than try to solve the problem with surgery. When something is so extensive and everything, you want to take what I call a central approach to it. So, the only danger with pseudo-pregnancy drugs, which have contraceptive effect, is that when you've achieved the purpose for which you set them, when the person gets pregnant, it's usually a multiple pregnancy. It's funny. It's quite seen with ordinary contraception. Those who are having the ejections, they stop their periods for 3-4 years. When they start, they stop it. If they get pregnant, it's usually multiple pregnancy. In other words, they make up for what they had lost. But
I've heard about those stories.
shall we say, if I do a laparoscopy and I saw like a chocolate cyst or something like that, and I have the means to deal with it through the laparoscope, I will do it.
Right.
But I will continue to use pseudo-pregnancy drugs. Because when you use pseudo-pregnancy drugs, the bleeding phase does not occur.
Indeed. You see, my issue with that, Uncle Ulrich, is I was put on the contraceptive pill when I started university. And of course, it takes care of the issue because it puts you into that some would say menopausal state because you're not bleeding.
Yes.
Which is great. But I felt like it was just masking the problem because when I came off the pill, the condition was there. And I would argue that the condition even became worse.
It's possible. That can happen. But it's a question of, shall we say, taking the lesser of two evils. Accepting the lesser of two evils. And I can tell you that from what I have experienced with the few cases I have been involved with, the outcome on these, watch, I'm not saying contraceptive, I'm saying pseudo-pregnancy pills. That is a proper selection of the drug you use. All of them have contraceptive effects. But the proportion of the various types of sex hormones that's in the tablet is geared to make sure what we call the decidual phase is effective, and these islands of endometrial tissue eventually become destroyed and absorbed by the immune system and removed by the immune system.
So just to be clear, the pseudo-pregnancy drugs, do they bring about that effect?
Yes.
What you're describing?
Yes.
So certainly this is something that women can be asking their doctors for routinely?
That's what I would recommend.
That's what you'd advocate?
You know, when you look at the issue of endometriosis by itself, not everything is known about it.
No.
but of what is known that does work, and it either abolishes or alleviates the problem, the use of drug therapy is best. And surgery should only be done when there are clear-cut surgical indications. The other issue I would like to talk is the issue of pain.
Oh, yes.
You see, people who don't have endometriosis can have pain with their periods. Unfortunately, in my view, in the last 30 years, what I have noticed is that our profession has become obsessed with the idea of abolishing pain to a degree of totality that they've ended up creating drugs which end up creating addiction in people. Now, pain, in my view, is an indication of the body's defense mechanisms to say something is wrong. And in my view, there's hardly any pain that actually lasts forever. It's also my view that the interpretation of brain by the interpretation of pain by the highest centers of the brain related to pain can come into the meaning of pain, in the sense that you can have pain which you actually ignore and you don't die from ignoring it, and eventually the pain goes when the problem causing the pain goes. If you were stuffing yourself with painkillers, you probably develop some complications from the overuse or misuse of those painkillers. But having said all that, in gynecological pains, usually need a combination of an analgesic agent and an antispasmodic agent. It's the best combination, and they should be only used for as long as it's needed. Not trying to prevent the pain.
Of course.
Not taking the drug before the pain comes.
Not taking the drug before the pain comes.
Yes.
Now that's interesting, because I was advised to take painkillers before the onset of pain. The idea being that you have enough in your system.
I have no quarrel. I have no quarrel with that advice.
So that you're
Because
able to
you
deal
see,
with the pain.
you see, it depends on your own concept of what pain is and how it should be handled. And I can assure you that I've yet to think of a patient who I think died of pain.
I guess the issue is when you're going through the pain and it's so
I've seen patients dying
intense.
with pain, but not dying of pain.
Yeah. So, I mean, from a medical standpoint and in terms of, say, natural painkillers, are there any suggestions? Is there any advice you have regarding
Yes.
natural painkillers?
Now, for a start, I will say this. There's a lot to be gained from traditional measures for any form of medical condition. A lot to be gained. When modern painkillers are used, the simpler the painkiller, the better. I remember when I was young, the main painkiller was just aspirin. Paracetamol, for example, only emerged when the petrochemical industries were developed. And when that was developed, certain people with more financial issues in their minds decided to kick aspirin out. And articles appeared in the journals showing how aspirin caused bleeding in the stomach, aspirin was literally demonized. In fact, when I was in medical school, if you mention using aspirin, oh, you are about to face a court martial. Remarkably, after I left medical school, after a long time, aspirin was brought back as a blood thinner. You see,
It's very popular.
in our profession, we just go through cycles like the pendulum. 1 minute,
It's
we are
popular.
detaining patients
The
in
next
hospital
snap.
as if they're in prison. The next minute, we're kicking them out the day after the operation. It's all that pendulum swinging.
Yeah.
So, I believe that what you need to take are substances, call them drugs, call them herbs, call them anything, which can modify the appreciation of your pain. In other words, something that if you were studying the impulses in the nerves and they were that high, but when it got to the brain, it was interpreted as a low level stimulus. So you don't become someone who's expressing agony. You're somebody who's having a discomfort. Like, for example, you see right now, I'm doing this. This shoulder has been disturbing me since I was enjoying the Christmas dinners. I have a touch of gout, and I haven't taken any medicines. I select to ignore it. In fact, the treatment I've given it is to take the pain. I enjoy the pain. You see, because everything is in the emotion. And so long as I can put this joint through all the range of movements, my pain goes.
Press into the pain, as they say.
It's in the mind. Now I'm coming back to, I've closed it up. Coming back to this thing about conditioning the mind and finding substances. I recently made a very interesting observation. And I want you to listen to this carefully.
Listen up, guys.
Local anesthetics, we call them local anesthetics. But in fact, they do have an effect on the sensory cortex.
Local anesthetics have an effect
On the sensory cortex.
on the sensory cortex.
We use local anesthetic to freeze an area of skin to do an operation. But in fact, when it's absorbed and goes into circulation and goes past the brain, it does modify the way the brain interprets the pain.
Okay.
Now, there are new preparations which the pharmaceutical industry are bringing out, where you combine an intermediate type of painkiller like diclofenac with a small amount of local anesthetic.
Oh, really?
Inject it into the muscle, and it's more effective than giving morphine. Fact, hard fact.
That's interesting. I can believe that because it's got anesthesia.
I believe that people who take traditional herbs, and I'm not naming them, on a regular basis, have so many benefits. They will feel pain less, I believe, because of what they take, which have the effect of a local anesthetic, for example. We don't know them. We haven't done research on them. But what we've found out is that herbs that are bitter carry so many benefits that we have not, in fact, scientifically exhausted the investigations we should do to find out what they actually contain. So, those who take bitter herbs have unknown benefits. But by saying that, I'm not inviting the world to kill themselves with large doses of herbs. Traditional herbs throughout the centuries have been used sensibly by taking small amounts on a regular basis. The way the world is going now, people want to have everything done so quickly.
Instantly.
For
It's not
example,
gonna work.
you can prescribe somebody some drug for pain. After reading through the literature and find out it's not going to kill them, if you ask them to take 2, they will take 6. The reason why, they want to make sure they go to work the next day to make money again. There is no discipline in taking things a little bit at a time and on a regular basis.
Little and often.
So, herbs also contain, many of them contain hormonal substances and elements. And I'm just guessing, it's a guess, that if we look through all these herbs, we may find something that sorts out endometriosis. Let me tell you why I have hope it's happened. When we were boys and we got to puberty, we were given the stem of a plant to chew. It was called cushement. This is in Sierra Leone. And it brought up the rapid development of our external genitals. We stopped being boys and started being men.
You heard it here.
So
guys.
obviously, it's hormonal.
Wow.
Yes. If you go to the villages, you'll find cushement. That's what they give to boys when they're about 11.
This is the first time I'm hearing of this, actually. Cushement. All the villages in Sierra Leone?
Many of them.
And that's the actual name?
But
that's known by?
these people who are so vicious on our forests, chopping down all those trees
This
to
is
build
the
houses,
thing.
they may have destroyed.
This is the thing.
The cushement I chewed came from Hastings village, where my ancestors come from. I don't know whether there's any of Hastings village left that you can call Hastings.
It's like that Amazon forest.
It's all
being
now a
decimated.
mad grab of land and
Yeah,
indiscipline and,
that's the world over.
you know.
Well, that's interesting. I'm glad you mentioned earlier on, Uncle, about the bitter leaf. Because that's something that I have been following. There's a protocol that my uncle has devised for me, for my mother and I, actually. And this is something that my uncle swears by. And I'll let you talk a little bit about that, because
Well,
that really seems to be this kind of all-encompassing natural herb that you can take that can help a host
my
of
interest in
ailments.
bitter herbs came out of a common sense approach on long life,
Long, healthy life.
long healthy life. In my family, on my mother's side, there are so many people who have hit the 90s. And for Africa, that's too good. And all these people were people who benefited from the medicinal garden that my grandmother had at number 9 Stewart Street. So, I took an interest in people who live long. In the Gambia here, I attended to a lady who made 105. And when she was 104, she could actually thread a needle.
Wow.
Yes. And if anybody went, as soon as you spoke, she would see you, she could do it, and she was still doing gardening. But when you talk to her, say, when you were young, what were they giving you as medicines? What they tell you is, we were given bitter herbs to take. And they will name a few. But one of the most common factor in all these people is the bitter leaf.
In the West, just for those who might be wondering what the equivalent is that the bitters atters? Is that what they call it?
Well,
Or is that
Atwood
slightly-
bitters
Atwood bitters.
is a commercial product, and I'm sure it contains extracts from the bitter leaf.
Extracts, okay.
It's a commercial product. Somebody's made it,
Sure.
blended it nicely, put it in a bottle,
Packaged it.
packaged it properly, advertised it. Yes, it worked.
What we really want is to use the natural version, which is 100%.
If you go to Asia, you'll find a lot of the Asiatics who live long are people who are taking their own bitter herbs. Every continent, every area has what God, the Almighty, has provided. And what you find in your locality has a relevance for being there.
There's a reason.
Yes, for your environmental problems. So, the interesting thing is that the best of herbs are bitter.
Can't get away
The
from
ones
it.
that really benefit people are bitter. And it's so interesting. People get deterred from taking these things because they don't like bitter things.
Yeah.
Yeah. In fact, I would recommend the regular consumption of bitter herbs in a safe way for most of the population all of the time. We're going to come to a time when people will not afford the cost of immunization, the cost of medicines. And that will be, I'm talking about the masses, not the privileged ones. And those people will have to resort to the traditional herbs.
So in your opinion, Uncle, what do you reckon is the effect? You've spoken generically, but say women who may have gynecological conditions such as endometriosis, fibroids, what do you think the effects of consuming bitter leaf on a regular basis in small doses could have on the body?
I'm sure it will help them. But talking of, you mentioned fibroids. There is a leaf, a plant, which the young leaves, if they are used as a tea regularly,
As a tea.
yes, drunk as a tea regularly in women with fibroids, I've proved it, the fibroids will shrink.
What's this plant called?
Black tumbler.
I remember Black Tumbler as a little girl growing up in Sierra Leone.
Yes, you open it, but the leaf,
The actual leaf.
the leaf is good for the female pelvis. My grandmother used
Wow.
to give to women with infertility, and many of them got pregnant.
I wish I'd known this many years ago, because I also happen to suffer with fibroids, and that's caused me untold problems, heavy bleeding,
Yes.
the pain, but obviously the endometriosis just exacerbated everything, and the focus then became on the endometriosis. But that is very good to know. I had no idea.
I've done a study on quite a few women here in the Gambia who had fibroids, and I put them on the black tumbler leaf protocol, and in many cases, following them up with ultrasound, you can see a steady reduction in the size of the fibroids,
Wow.
and a few of them got pregnant.
Wow. That is good to know. That is good to know. So that's one thing that you can
When
bear
I say a
in
few of
mind.
them got pregnant, they got pregnant and held the pregnancy.
Yeah.
Well, with fibroids, you can get pregnant, can't hold it because the fibroid is
Yeah,
occupying the space.
Competing with a baby. Yeah. So that's one good thing to bear in mind for those of you who might also have the misfortune of suffering with fibroids. But is there an equivalent, say, to that black tumbler leaf with regards to endometriosis that also has?
I wouldn't know. I haven't.
Positive
I don't
effects.
know if there's a direct connection. But what I'm saying, what I would say is there's always a place for people to do research by observation, by association. In this part of the world, we don't have facilities to run through scientific laboratories, except in a few places. And most of the research is directed to endemic diseases that cause death and this and that. But there's a need now for the universities to open a department for traditional medicines in the medical schools, as been done in Nigeria, and which has been, shall we say, established fully in Cuba.
They seem to be leading the way.
Oh, they're leading.
Trailblazing.
The Cubans are way ahead of the rest.
And we have a lot of Cuban doctors here in the Gambia, which is a good thing.
Yes. In Cuba, in my view, has the best medical services in the whole world, on this planet.
Amazing. That's always a good thing to know. I've never been to Cuba, and that's another reason.
They give the best access to health by putting advanced medical facilities at village level.
Fabulous. Because that's where it's needed, right? No point going to the cities.
If you have to go to the cities, it has to be something really, really big. But even still, they have the means for evacuating and referring.
And finally, I didn't want to make this a long video, but it's going to be a real struggle when I have my own personal walking encyclopedia, walking oracle, my own life instructor here with me to condense it all into 5 or 10 minutes. No doubt there will be further videos, but I just want to end on one final topic, which is the bitter cola, which again my uncle introduced me to. And my mother and I have been taking that on a regular basis since we got here. And again, it's one of those natural products that have all-encompassing, brilliant, positive side effects. Uncle Ulrich, can you just tell us a little bit about the bitter cola?
Well, bitter cola, like most bitter things, has a lot of goodies in it. And one important thing I must say is that when bitter cola is used, it doesn't need to be used in large amounts, only used in small amounts. Bitter cola has many beneficial effects on the respiratory tract, on the bowels. It helps diarrhea. It blocks the effects of alcohol. Bitter cola is very good for the mouth. It soothes the gums. It suppresses dental caries. But its greatest benefit of bitter cola is in the suppression of all infections. When somebody becomes contaminated with microorganisms, if the person is somebody who takes bitter cola on a regular basis, the illness that should come seldom, if ever, comes. Bitter cola contains a principal substance which does not allow microorganisms to replicate. And anybody who in that situation has a competent immune system will find that these organisms are engaged by the immune system, antibodies are produced and destroyed. And the next time they come, larger amounts of antibodies are produced, and the person has actually got the effect of a vaccination, of an immunization.
Amazing.
So, speaking to people recently who have lived beyond 90, I found that many of them did the bitter cola habit, and I was not surprised. These were people who were born when there were no vaccinations, there were no antibiotics, and of course, they were seldom going to hospital to see a doctor.
Amazing, amazing. So guys, two big takeaways I think from this video would be those natural remedies that we've discussed, the bitter leaf and the bitter kola nut. Something for you to consider, food for thought. As you know, we're at a stage where there's still no known cure for endometriosis, but there are certainly things that you can take, particularly of the natural variety. As you know, I am more in favor of natural remedies as opposed to traditional, over-the-counter drugs. And, if you can deal with the issue through natural medication and avoid surgery, then even better. So something for you to think about. My intention, from setting up this platform is to try and share whatever information I have, inform, educate, empower. And so I hope we've managed to do a little bit of that today. Uncle Ulrich, I would love to talk to you some more before we travel back to the UK.
You're most welcome.
Sadly, it's not going to be possible to do it all in one sitting.
You're most welcome.
I fear.
What I would like you to do for you, a session, is the way to use traditional herbs safely.
Okay. Excellent.
It's one thing to recognize the benefits. It's another thing to know how to use them. And it's very important.
It is.
I remember one patient that I treated once for a condition. And the medication I gave was so effective after taking the first 2 doses. The patient then decided, well, if I take 1 tablet and it's so good, maybe if I take 10, I won't need to see Dr. Jones again. And the patient did that. He does that.
Oh dear.
And overdosed. And I had to really work hard to get him right. So, whether you're taking traditional medicines or conventional medicines, you want to get the dosage right.
Sure.
And may I say this? The way this world is going, with the emphasis on this word fake, I think fake drugs are going to dominate the news cycles very soon. And fake drugs I'm talking about is drugs which are presented to patients, nicely put in capsules and this and that. And then, in fact, they're not what they're supposed to be. And for that matter, when you're using traditional herbs, you have to make sure you are using the right thing in the right circumstances. A lot of these people who live long, the secret, I believe, for life is having a sound immune system. It's logical, it's common sense.
Of course.
And there is no doubt in my mind of the benefits of bitter traditional herbs in boosting the immune system.
I think that's a great note to end this on. So, is it fair to say, actually, when you have an illness like endometriosis, your immune system is a bit compromised?
In a way, you can look at it that way, because anything in the wrong place would normally be removed by your immune system. The mechanisms to special cells you call phagocytes and this and that. There's so many mechanisms for things who are in the wrong place. Take cancer, for example. One of the most gullible theories about cancer is that cancer cells are formed in the body every day by abnormal cell division. But they're recognized for what they are and removed by the immune system.
But your immune system needs to be strong
Yes.
to do that.
To do that.
So guys, Your immune system may not be strong, but there's no reason why you can't start to strengthen the immune system today.
Yes.
So stay tuned. I intend to get as much information and knowledge and everything that I can get from my uncle while I'm here. And we will be bringing you another video real soon. In the meantime, thank you for watching. And as usual, like, share, subscribe, so that when I do produce my next video, you get to see it and hear about it automatically. In the meantime, lots of love and God bless. Take care. Ciao.